We owe it to our children and to our country to do everything in our power to address this national shame and this human tragedy.
Today, President Trump himself declared a public health emergency to fight an opioid epidemic. It's taking 140 lives in America every day. And overdose rates here in Bexar County are the highest in the state of Texas. Eyewitness News reporter Andrea Martinez tells us what local officials are doing to combat the problem.
It's so addicting physically. You have to have it, or you go into physical withdrawal and you're very, very sick.
Cynthia Dandridge struggled with her heroin addiction for 20 years.
You think that that's the solution to your problem. Like now everything's gone. I don't have to think about it. I don't have to feel. I don't have to remember.
She's not alone. Last year, nearly 12 million people abused opioids. To combat that, President Trump declared the crisis a public health emergency, which will streamline some access to addiction treatment. Brian Clark is a physician assistant who treats addicts daily at healthcare services and sees it firsthand.
2/3 of our patients are for opioid addiction. It's not alcohol. It's not cocaine. It's not Xanax, it's not benzos or sedative hypnotics, it's opioids.
Earlier this year, local officials put together a joint opioid task force to combat the problem. Federal money was also allocated to provide training, education, and the use of naloxone, a medication used to reverse the effects of an overdose. But for addicts, it takes more than that. Cynthia says treatment truly saved her life. She now works as a licensed chemical dependency counselor, helping people just like her overcome addiction.
They look at me and they believe that I get what they're going through. And I do.
Many have criticized Trump's decision to not make the crisis a national emergency that would have provided access to billions in federal funds. Andrea Martinez, KENS 5, Eyewitness News.